Professor Brittany Morey here, and today I want to talk about how deportation and detention impact the public's health. Deportation and detention impacts individuals who are detained and deported because they are detained often in unsanitary or squalid conditions, and that these conditions they don't have access to health care. And also the stress and trauma of this experience of being detained, of being deported, has a long-term impact on people's health. But this does not only impact individual health, it also has an impact on the families of those who are deported and detained, on their workplaces and on their communities, who have now lost an aunt or an uncle, a friend, an important member of that community. The vast majority of people who are deported and detained have been embedded and lived in these communities for many, many years. And the stress, the separation of those people getting separated from their social networks has an impact on the wider community. And especially because many of the undocumented persons who live here in the United States are part of mixed status families, which means that they have family members of various immigration statuses, and also that includes US citizens. And so deportation and detention doesn't only have an impact on individuals, and it also doesn't only have an impact on those family members and friends, but also just simply the threat of deportation and detention is increasing stress, vigilance, and fear among many of our mixed status families and communities. This is causing many people to have, including children, to have a negative impact on their mental health, as they are fearful that their family members, that their parents might get stripped away or that they may get separated from their family members. And this has a really terrible impact on the development of children's brains and their levels of stress. This is also impacting people's access to important healthcare resources as people are avoiding healthcare, avoiding interactions with the healthcare system due to the threat of their family members possibly being targeted for deportation and detention. But there is something that we could all do about it. First of all, as public health professionals, we have the responsibility and the skills to document the impacts of deportation and detention on community health, and to share this with the public, not only the health costs, but also the social and the economic costs. For those of you who are in mixed status families or who know someone or are someone who might be under threat of deportation and detention, it is important that you know your rights and that you, as a family, have a plan for what should happen if the worst would happen. Also, organizations, healthcare systems, schools. If you have are in the leadership of one of these organizations, then you should have a plan. Should Immigration and Customs Enforcement come to your facility looking to detain people? Organizations have a responsibility to protect the people that they serve, especially our healthcare organizations. And like all emergency preparedness, these plans are put into place in case the worst should happen. And lastly, advocacy is extremely important, and not just advocacy on the federal level, but also at the state and the local level. What can we do as a community, as families, as places of worship to look out for those who are most in need? In public health, we have the power to impact the health of our communities, and the health of one member of our community, in fact, impacts the health of all.